Okay, hello. Thank you everybody for coming today. This is our Housing and Place Cluster Seminar, and to come speak to us we've got Becky Tunstall, who's the former director of York University Centre for Housing Policy and visiting professor at LSE Centre for the Analysis of Social Exclusion. And she's going to talk to us today about housing insecurity and its relationship to financial, work, health and care insecurity. So a really cross-cutting topic that I think relates to all of the work that we do and the different kind of research clusters that we have today. So thank you so much, Becky, for coming to talk to us. I've got everybody on mute, but I will take questions at the end, and I'm going to share my screen to share Becky's slides, and then we will. Right. I'm going to try and PowerPoint live. No, I'm not. And if anyone has any problems, could they let me know in the chat? Thank you. Now over to you. Absolutely.
Thank you very much. And thank you very much, Becky. And it's lovely to be with another Becky. And thank you very much, everybody, for coming, because I know you could be eating spaghetti or doing something else at this moment. I'm going to talk today about quite a big chunky project that involves a lot of different people and a lot of different parts. But your CRESR colleague, Johnny, was a very important member of the team, and two other Sheffield Hallam people are involved as well. So you can see all the names down there. Sally Pearce and Helen Lomax are also on the team. And this project is looking overall at the idea of multiple insecurity, security in different dimensions. But the thing that most interests me and that I want to talk about today is how housing insecurity fits into this complex picture. So next slide, please, Becky.
I am going to slide. There we go. Sorry.
Great. Okay. First of all, a quick mention for the Ministry of Housing. 10 months is a very short time in the world of research projects, but obviously it's a long time in politics. And a project that started out focusing on levelling up has sort of transmogrified slightly over its lifetime as the ministry changed its approach. Next slide, please. Oh, is that on its way?
Oh, has that not worked for you?
Not for me, no. Oh dear. Here we go. Thank you. Yeah, so I'd just like to talk about the idea of multiple insecurities in general. So the project was looking at the idea of multiple insecurities, and the team saw this as a new way to think about barriers to opportunities. And of course, there are many other concepts that you're familiar with, but we thought this offered something slightly new. So our idea was that security is extremely important, and people who are secure and feel secure and don't have to worry about the worst kind of things that can happen are better placed to develop their capabilities, and in the language of the project as it began, to contribute to and benefit from levelling up. And of course, politicians value security. And although Rachel Reeves' policies have had many ups and downs over the short time she's been in power, she has written about the value of security as one of the core elements of her economic programme, and the idea that the role of the state is to provide the platform from which to take risks rather than to allow people to live in a world of risks which threatens to overwhelm them. And just to show that there, obviously lay understandings of security also value it highly, one of our research participants who chose the pseudonym Clara Louise said that she would love to be in a place where she could feel safe and just content, that she didn't have to worry about paying the rent and buying food, and they could be healthy and safe. And it sounds quite basic. So it is the basis from which to do other things. Next slide, please. So writers over the last 20 or 30 years have talked about trying to understand modernity as an age of insecurity. And there have been many different versions of this over these last years. All kinds of sociologists and writers on urban systems have thought about this. And again, this is echoed by Reeves, who must have read some of these sources and has talked about how we are now in an age of insecurity, but it's a sort of long now that's lasted for 3 decades or more. Next slide, please. So the questions I'm going to talk about today are about the place of housing within this possible age of insecurity. What role does housing play in it? And are there causal relationships between housing insecurity and other forms of insecurity? And if we're focusing as housing researchers on housing insecurity, could reductions in that also have knock-on benefits for security in other dimensions of life? Next slide, please. So what about this concept? And if you're interested in this, we've got a lot of literature work that we've recently published on the CRESR LSE website looking into this. And as I said, insecurity is similar to terms you're probably very familiar with and probably used a lot. And you might say, why do we need to think about yet another term? And in some ways, it is very close to precarity in particular. But we just wanted to focus on a term that included current states, objective situations, and also subjective and prospective. Because when people are thinking about their security, they are thinking about what might happen, what the risks are, what their feelings about those risks are. And I think it has a particular focus on people's mental states. So about what's going on in people's thoughts, how they're thinking about risks and how they're reacting to potential risks and current threats. And we'd argue that although insecurity is about things changing or possibly changing or bad things happening, it could also be about stable long-term deprivations. So if you're on a very low income over a very long time period, there is a constant risk that you're not going to be able to meet your basic needs. So we also thought about insecurity and how it can exist in multiple important domains of life. So as housing researchers, we're familiar with the idea of housing security. And in sociology and wider social policy, insecurity is often thought about in terms of work. And precarity, for example, is often thought about mainly in terms of work. But there's also been a lot of work on food insecurity, income insecurity or fluctuations. And we wanted to take it beyond that to think about other dimensions, such as insecurity about health, about whether you're going to get enough care or whether you're going to be under a lot of pressure to provide care, insecurity in relationships and other dimensions. Thanks. Next slide, please. So what we did, did some initial interviews with policymakers and practitioners, and Johnny was involved in that. We did multiple literature reviews on different dimensions of insecurity, some quantitative analysis using Understanding Society, and field work in 4 neighbourhoods, including 2 in Sheffield, which you're probably familiar with, and also other places around the country. East Lindsey is in Lincolnshire. Then we looked at potential policy and practice responses and checked out things with some practitioners when we got to our findings. Next, please. And this is a chart that shows the sort of scope of insecurities and what we were able to look at in the project. So we used the capabilities approach and the multiple inequalities framework developed by people at LSE for Oxfam to think about what all the important dimensions of life were, because we kept arguing amongst ourselves and adding new ones, but we thought this was very helpful. So housing is key, but you can see there's a whole number of dimensions there: finance, work, health, and moving on to things like how your neighbourhood is, what your relations are like, your relationships with institutions and education. And you can see that we managed to cover a good range of these in our different bits of work, but there are some gaps as well. And particularly on the quantitative side, it was hard to cover some of these issues. Thank you. So let's think about housing insecurity as a starting point. I feel embarrassed talking to you about how to measure housing insecurity. Many of you have done much more thinking about this than I or the rest of the team have. But we're clear from the literature and other work that's already been done that there's a subjective an objective element to housing insecurity, as with insecurity generally. And definitions often focus on the idea of losing the home and how likely that is in your mind or in fact. But there are other aspects of insecurity, including the adequacy of housing and having housing that either inhibits or acts as a platform for other important capabilities. So very expensive housing means there's a threat to the ability to provide good food and so on. Insecure housing has not been often defined by at least British public bodies, but Public Health England has recognised the idea and this multiple aspects of insecurity that are important for health. So when it comes to thinking about housing insecurity, people might immediately think about homelessness or temporary accommodation, refugees, but it's clearly wider than that as a concept. It's not just about private renting. You can't be defined as linked to tenure only because it's a bigger concept. And when it comes to measures, a huge range of things have been used, going from the narrowest tenure, payment default, to much broader things like satisfaction, and then complex indexes that have been developed. Next slide, please. So we also looked at the literature to explore the relationships between housing insecurity and other insecurities that were already discussed. This tends to be talked about in quite general terms in the literature. So it was quite hard to pin down precise forms of housing insecurity that were linked to other precise insecurities or measures. And we found interesting things from the big surveys that Citizens Advice and the Tunstall Trust have done, looking at their clients and the multiple issues that they approach with. So they said that Citizens Advice said that one cost of living issue like housing is often linked to others. And the Tunstall Trust said that if a person is food insecure, they're more likely to be housing insecure than average. So those two things go together. And the development literature says the same, looking at countries worldwide. And there's been some recent work also looking at the relationship between insecurity in work and insecurity in housing. So people in insecure work are more likely to be in private rented housing, which is one way of thinking about housing insecurity. Next slide, please. So on the basis of that, we thought there's definitely scope for looking more at how different insecurities interact in people's lives and are found together. And housing insecurity is part of that story. So in the quantitative research, we used Understanding Society, and we thought about the measures that are available in it for all the different kinds of insecurities we were interested in. And we were able to find good measures for 5 dimensions of insecurity, including housing. We were looking for measures that were available every year. So that meant some dropped out. And for example, we weren't able to look at food insecurity because that's only asked about in some years. And with housing, we did end up with a rather narrow set of indicators. So being behind with housing costs, having expensive housing relative to income, and being in private renting. So you can see that narrowing in there. But across the whole range of measures, there are some subjective ones in this set here. And there is one prospective one talking about what will happen to your financial situation in a year's time. Overall, this is the sort of situation where the quantitative data set narrows you in from the concepts you've just spent lots of time thinking about. Next slide, please. So we define somebody as insecure in any one of these dimensions if they were affected by one of the indicators or more. So somebody could be housing insecure if they were simply behind with housing costs last year. And next slide. Then we define them as multiply insecure if, like for this person here, they had at least one indicator and at least 2 dimensions of insecurity. So this person is housing, financially, and health insecure here. Just to give you a sense of that. Now, you've already seen the danger slide that's coming up next. We were amongst the first people, I think, to use the 22-23 data in understanding society, and I hope other people have looked at it by now, and we can have a good conversation. Next slide, please. So we realized that something slightly strange was going on with the 22-23 data, and that's because that's a year when the sample was boosted with extra people to take account of in-migration into the UK. And so the years between those dates you see there are weighted to take account of in-migration, but don't have new people added to the cohort. And we think there may be something going on with weighting, but nonetheless, the dates you see there are absolutely robust because they're nationally representative samples, including recent migrants. So this is not something that just affects our project. Unfortunately, it affects everybody who's using Understanding Society, and it's just a question mark, but I do need to mention it. Next one, please. So let's look at the quantitative results on housing insecurity if you use these simple measures and Understanding Society. So the bottom three lines show the trends from 2009 up till 22-23 for those three individual measures of housing insecurity. So the yellow line is people being behind with the housing payments, and this is percentage of adults, so it's 5 to 10%, and going down slightly over the period. The grey line is people with housing costs more than 30% of income. And then the blue line is the PRS. And you can see immediately what I'm talking about here was a sampling weighting issue. So there's no explanation for a rise in proportion of people in the PRS between 21-22 and 22-23 out in the world. And other data sets don't show this. So there is something going on here. But nonetheless, if you just focus on the first date in the series and the last date and 2014-15, where we know there were samples that were fully representative of the population and the weighting matched that, you can see there are big trends here. So the orange line shows the proportion of people affected by any one of these three indicators. So overall, since the global financial crisis in 2009-10, there's been a decline in people affected by these measures of housing insecurity. And then apparently a further decline, or there are some questions about the weighting and so on. But by 22-23, the overall rate of housing insecurity is nearly back to what it was immediately after the global financial crisis. So I think you can argue that whether if there was a age of housing insecurity after the global financial crisis, we're now in a renewed age of housing insecurity after what looks like quite a long decline. Next slide, please. So let's look at that another way. If we just take the latest data for 22-23, who is affected by these three indicators of housing insecurity? So if you think about all adults, it's a quarter of the population, 27%. But then if you look at subgroups, there's quite different rates. So the very highest rates are for lone parents, and also, interestingly, lone adults of working age who are emerging as a new deprived vulnerable group in quite a lot of different surveys and for different measures. And then unemployed people, more than half of unemployed people are housing insecure, people of Black and minority ethnicity, young people, Londoners, people in deprived areas, and women are slightly more likely overall than men to experience housing insecurity. Next slide, please. And if you look at the long-term trends, I was quite surprised by this result. So over this 13-year period with huge amounts of social change, you would have thought in the UK, the patterns in who is most affected by housing insecurity using these measures have not changed greatly. I mean, they're very, very close all the way through for all of these groups. So these groups are in a long-term position, some kind of structural position of greater risk of housing insecurity. And this isn't something that just come and gone according to economic fluctuations or policy change. Next slide, please. Right, okay, that was housing insecurity. So let's look at the other major insecurities we're able to look at quantitatively. and look at the trends here. So in yellow, you've got health insecurity. In grey, you've got work insecurity. Now, the trend there is slightly down, and that's because one of the indicators we used was the proportion of people in low paid work relative to the median, and changes in the living wage, the national living wage, have had some effect there. We've already looked at the orange line, which is housing insecurity. You can also see caring insecurity, which is simply measured by the proportion of people with caring responsibilities other than childcare. But the biggest, the most dramatic changes over this period are clearly for financial insecurities. There was a big drop after the global financial crisis. And then from the mid-2020s, there's a pattern of increase, and quite sharp increase in the recent years. And that's partly going to be the pattern and the timing of change may be partly affected by this weighting issue I mentioned, but the absolute level achieved in 2022-23 is not. So 47% of the population were affected by financial insecurities in that year. So I think it's quite interesting to look at the different trends for these different insecurities and how they have changed in different ways. I think if you were able to develop the measures more and include more indicators, you might see slightly different patterns. We were all quite surprised by the non-appearance of the pandemic in these lines. That may also be partly due to the way that data is collected continuously in understanding society. So it slightly blurs out the annual change. Next slide, please. So what about the way that insecurities combine with each other? This chart shows the proportions of people over this time period who've had housing insecurity plus some other insecurity as well. And you can see on the left there, housing and financial insecurity. It's a smaller group of the population. So it was 47% in 22-23 had housing insecurity on its own, but when combined with financial, it's down to 16%. But that's still a big proportion of the population to have these two quite large worries and uncertainties and difficulties pressing on them. And you can see there's quite a pattern of change over time there for housing and financial insecurities. Whereas in contrast, there are also quite a large proportion of people affected by housing and health insecurities, but because health insecurities are relatively stable over the period, that's how the pattern has worked out for the combination. Housing and work has insecurity combined declined because of the changes in work insecurity as well. Thank you. Next slide, please. Now, this is looking at triple insecurity. So we're really getting into multiple insecurity here. And I think if you look at these combinations of housing, finance and health, housing, finance and work, finance, health and work, and others, there is an argument for saying we are in an age of multiple insecurity, because again, these are quite high proportions of the population. If you look at the first one, housing, finance and health, in 22-23, 9% of the population of adults, that's large number of millions of people dealing with a lot of problems on at the same time. And there's been a trend down and then up again. So on that particular combination of housing, financial, health insecurities, you could argue that immediately after the global financial crisis, you would expect quite a lot of multiple insecurity. You'd expect improvement. We're back above that level now. And one thing I'd like to think about in policy terms is there's an absolutely gigantic policy response to the global financial crisis. If you think about governments around the world spending trillions of dollars on stabilizing the system and dealing with that insecurity, we're now at an era of at least national multiple insecurity affecting citizens, but there's nothing like the policy response. There isn't really the recognition that people have got so much on their plate, although clearly coming through the culture, you can feel there's a lot of unhappiness and difficulty. Next slide, please. So now I want to focus in on exactly how housing and other insecurities link together. So this is just looking at overlaps, and I could have presented a series of Venn diagrams, but I wasn't clever enough to do that. So, and this is to take the baby steps towards thinking about causality. So here we go. In this chart, you can see in red that in 22-23, 27% of all adults had housing insecurity. But then as you go down, if you look at different combinations, 16% of all adults had housing and financial insecurities. And then the right-hand column thinks just about housing insecure people and what risk they had of having the other insecurity. So if you were already housing insecure, your risk of being financially insecure as well was 59%. So that is more than half of people who are housing insecure are also financially insecure. And it's quite similar for health and for work, also very high rates of risk of the other insecurities. Now, care insecurity affects a smaller proportion of the population, so you get less of an overlap there. If you look at the triple insecurities, you get the same pattern. So out of the whole population, only 8% are housing and financial and health insecure. But if you're already housing insecure, 1/3 of those people are also going to be financially and health insecure. So they have a lot of things going on. Next slide, please. I think this next one's very complicated. Yes, so I'm sorry to be bugging your brains with quite complicated charts, even if they're just these simple kind of tables. So this chart is looking at the relationship between housing insecurity and other insecurities for different groups of the people. So looking at the first line, 27% of people are housing insecure, and 8% of all people have housing insecurity plus financial and health. So 1/3 of all people who are housing insecure have these other insecurities as well. But if we look at different groups of people, the transition from having one to having multiple insecurities shows different patterns. If you're long-term sick and disabled, and then you jump over to the right-hand column, 80% of all long-term sick and disabled people who are housing insecure are also financially and health insecure as well. So the long-term sick and disabled people are at great risk of having multiple insecurity and dealing with a huge number of things at once. Half of all unemployed people who are housing insecure are also financially and health insecure. And then you can see the pattern going down. And I also want to highlight the figures in green. What that shows is that people who are housing insecure in those categories are less likely than average to be multiply insecure. So for them, the housing insecurity is more likely to be a distinct issue that isn't linked to lots of other insecurities. And those people with the green figures are younger people, people of Black and minority ethnicity, and people in London. And you can start to see how this kind of simple data can lead you onto policy ideas, ideas about targeting. So there's a group of people in London, say, who've got housing problems, but they don't have so many or such high risk of these other problems as well. And it's something to do with what's going on in the housing market in London, naturally. But for long-term sick and disabled people across the UK, they have a complex nest of problems going on at once. Next slide, please. Then this slide shows the same data for 22-23, so how housing insecurity translates into multiple insecurity, but it also shows it for the first data point, 13 years before. And what you can see here is, again, remarkable stability in the relationship between housing insecurity and multiple insecurities for different groups of people. So there's nothing new about long-term sick and disabled people having high risk of financial and health insecurities as well. So although there have been lots of changes in the individuals in that group and the nature of their sickness and disability, it's still linked to these other problems too. The same with unemployment, the same for lone people below pension age for deprived areas. So again, these data suggest that there are quite long-running issues going on here which are linking these insecurities together. Next slide, please. And I just wanted to focus on some other data that we produced thinking about why multiple insecurities might be important, and so why housing's relationship with them is important. Obviously, the literature talks about the very important problems that housing insecurity itself can cause for well-being and other things. But this data here on the relationship between multiple insecurities and well-being is quite stark. So Understanding Society has a number of measures of well-being, including whether people feel constantly under strain more than normal, more trouble sleeping than usual due to worry, loneliness and isolation. And you can see here that, that these problems are quite prevalent in the general population. So 20-something% of people feel constantly under strain more than normal. But if they have multiple insecurities, that these well-being problems double or triple. And this data is just descriptive, but we also did work looking with multivariate analysis to try and explore these relationships more, and they remain once you control for all of the variables that we had at hand. Next slide, please. So in other words, in a very recent year, 3 million adults were experiencing multiple insecurities and felt constantly under strain. 2.5 million were experiencing multiple insecurities and having trouble sleeping. So I think this is really a serious, very serious issue. And you can immediately see that if the nation is under pressure from multiple insecurities and can't sleep, this is a nation that is going to be having some of the kind of problems that politicians are trying to deal with at the moment. Next slide, please. So I'm now going to move on to talk about a different part of the work. And I hope you can hold on to your questions on the quantitative part, because I'm now just going to say a little bit about the results of some of our interview work as well. And just to remind you, we talked to 36 people only, so it was quite exploratory, and they're in deprived neighbourhoods, and we got hold of them through intermediary organisations that was like community centres and small community hubs. So it's not a random sample in any way. It's people in deprived neighbourhoods who were already known to be experiencing insecurities, because we wanted to talk to people who definitely already had multiple insecurities on the go. Next slide, please. So this is Shirecliffe, not looking its best on a rainy day. Many of you may be familiar with it. Next slide, please. We also went to Mablethorpe in Lincolnshire, and this picture of delicious donuts also reveals the nature of the labour market. So you can work in a snack bar, an ice cream parlour or a shop. Not great jobs, also not only low paid and often 0 hours, but seasonal as well. So next slide, please. So colleagues from Sheffield Hallam, Sally and Helen, Sally Pearson, Helen Lomax, worked with an artist who developed prompt cards to help people start talking about these often rather painful or possibly abstract ideas of insecurity. And these actually worked really well. There were 8 of them in total, covering a range of different insecurities. And people found looking at the picture and holding something really helpful to get discussion going. And we talked to people both in focus groups and in individual interviews, and these seem to work well, better than a list provided by interviewers, better than asking people just to dream things up from their thoughts about what they might be undergoing. And people really got something out of holding on to things, spreading them out like this on the table, or shuffling them around. So Helen and Sally have used these cards in subsequent work as well to prompt people to talk about issues that might be facing them across all different parts of their lives. Thank you. Next slide, please. So just to go back to that issue about well-being, there was very clear triangulation here with the kind of things that participants said. All of them had multiple insecurities or identified multiple things, and all of them talked about that serious well-being problems, even mental health problems and mental illness. So, for example, these are the pseudonyms. Summer was homeless because she was about to become homeless because she'd broken up with her husband and they were selling the house. She was working and hoped to be promoted and was under pressure from DWP just to work more hours, and she didn't have any childcare to do so, and it was making her feel ill, drained, tired, unable to understand what was being said to her, complex information. And clearly that is not contributing to levelling up for her or for Sheffield. Winnie had 3 children. She was on her own with them in a damp council house, also in Sheffield. And she was trying to get diagnoses for her children, trying to get support for them, trying to get repairs for the house, and struggling with a small budget. And she just felt she was rushing around the whole time, chasing after things and always stressed. Next slide, please. So focusing on housing insecurity. Yep, let's stick with this slide. Sorry, can you go on to the text one? I just wanted to talk about how the participants had experienced housing insecurity, because there are a few surprises here for us. So 21 of the participants pulled out that housing card. And perhaps going back to the concepts and the literature, really what they were talking about went well beyond the definition we'd used in the quantitative work, which focused on affordability, tenure and false moves. So they were talking about relationships and powerlessness in relation to landlords, and some quite subjective things about disliking their homes, not feeling comfortable, fearing specific things like that their health was being damaged or that neighbours were affecting the way that they could behave. And they felt they were experiencing lack of choice as a big problem, where to live, who to live with, how to get out of the parental home, how to deal with breakups, and as well as threats of homelessness after all kinds of problems, including for elderly people after the death of a partner, or for carers after the death of the person they were caring from, and in one case, escaping from gangs as well. Next slide, please. So to describe this, a lot of the participants were secure social housing tenants, whether council or housing association, but more than half of the social renters talked about feeling housing insecure. So they should have a secure tenancy, and they should be secure according to some of the more objective measures. But on the other hand, they were dealing with really serious repairs problems and overcrowding. So in Milton Keynes, Chelsea said they've agreed to the repair 3 times. They haven't done anything, and every time I go, they've lost the paperwork. Brenda told a long story about a saga with a leak. She'd been told terrifying things by different workmen. And then she was worried about electricity problems with water, and she'd been told to tape a carrier bag to the wall. And Doris, aged, I think Doris was 92, she said, they said to me, you don't need to shout. And I said, you don't need to leave our bathroom festering like this. So despite having what you might call the right tenant tenure, these people were housing insecure. Next slide, please. Another issue for residents in social housing was overcrowding. So Karen had 4 people in a 2-bedroom home and didn't meet the local authority's definition of overcrowding, because many local authorities argue that you should use the living room as a bedroom to reach the bedroom standard. So she was sleeping in the front room because she wanted her children to have bedrooms. Billy was living with 6 people in a 2-bedroom home. He lived somewhere else some of the time, but he was worried about what it meant for his children, because there were difficulties in showering, dressing. There's just a lack of space, and it wasn't nice. Next slide, please. So yeah, that was quite a shock, just thinking about housing insecurity and how prevalent it was amongst these people, despite them being in many cases in what you might think was a reasonable housing tenure. And amongst the 36 people, there were lots of the combinations of insecurities that are prevalent at national level. For example, housing and health, housing and finance, nearly half of the group experienced those. Next slide, please. So we also were able with these participants to explore the causal links between insecurities as well as the associations. And probably the most important one nationally is financial to housing. And residents made the probably quite common sense point that if they were richer, if they had more income, they wouldn't have to wait for things to be done for them. They could pay for their own things to be done in their houses, even their council houses, and there'd be knock-on benefits for other insecurities like health. Adam said, if your economics become better, then other things will be solved. And Clara Louise said that finances affect everything. Next slide, please. But there are other comments about other causal relationships. Now, we were only able to sort of touch on these things in this relatively small number of relatively short interviews. But clearly this is an area to explore in more detail if possible, and to build on some of the quantitative data as well. So housing is linked to health, and Leonard was living with his ex-partner and was desperate to get out of this situation, which would be good for his mental health. Christina thought her house was so dangerous and unpleasant, her council house, that she wasn't actually living there, was moving around, but this was causing more expense, worse diet, so on. And Adam, who mentioned before, was struggling with everything because his house was so overcrowded. If you're not feeling confident in your housing, it affects all parts of your life. So that's very much going right back to the beginning, the idea that Rachel Reeves had about giving yourself a basis for other parts of your life. Next slide, please. So this is Adam. This is his life turned into an image by our team artist. So Adam was saying, work keeps you alive, but it does not take you to a better life. He was in this very crowded house, working nights in an area he didn't like, and worrying about the impact on his health and his family's health, but nonetheless helped by some things that there are in Shirecliff. The kids have been taken camping for free. There's a breakfast club. And the nursery in the area was very helpful. Next slide, please. And a similar story for residents in Milton Keynes. So Mike had given up his job to care for his mother because with local authority care he felt was not adequate. The result was they're both on very low incomes and unable to heat their homes properly. So they're eating porridge here and his mum is all swathed up. So multiple problems in their lives there, but there are some things that help, like the community cafe and in fact volunteering. So quite a number of the participants volunteered as a way to improve their well-being and also as a form of work that they felt they got recognition for. Okay, I'm nearly at the end now, come to the conclusions at last, and I can't wait to hear from you. So to go back to the questions, what role does housing insecurity play in the possible age of insecurity we're going through? Well, for the last data we have, if you look at housing insecurity, financial and multiple insecurities, they were at global financial crisis levels. So we could say this is a renewed age of insecurity. Housing insecurity affects a large minority of UK adults, including secure social renters. And it's often found with other insecurities, all that differs between people. And housing insecurities contribute to increases in multiple insecurities and the well-being problems associated with them, you would presume. Next slide, please. What about the causal relationships? Well, I have to apologize that in this presentation, in this research, we haven't fully cracked this. The literature says there are these connections. The quantitative data says there are associations, especially for finance and housing, and especially for some groups of people, unemployed people, lone parents, lone adults. And the participants said yes, that there are these causal relationships. For most, finance is the most important issue, but for some, housing is key. So if you're going to start dealing with their issues, you would start with housing in some cases. Next slide, please, and that truly is the end. So what role could reductions in housing insecurity play in increasing security more generally and ending this age of insecurity? Well, obviously, if you can reduce housing insecurity, you will reduce any other, the multiple insecurities that include it, things directly. I've lost the words, so I'm afraid I don't know this off by heart. Okay, here they go. And there are suggestions about how to target, as I was saying before. So people who are affected by housing insecurity in clusters with other insecurities will need certain sorts of support and intervention. But there are others who have housing insecurity more on its own, younger people, Londoners, and so on. And I think we've made an effort here with our quantitative measures, but you would like ideally to have more subtle ones that are more subjective and more prospective. And one thing we're interested in is the experiences of housing and other insecurities, not just from people in deprived areas, but people in less deprived areas, because these insecurities stretch a long way across the income scale, given that housing insecurity affects 47% of UK adults. Thank you.
Thank you, that was amazing. Thank you so much. I'm going to go to questions, and if people could pop them in the chat, that would be fantastic. Or raise their hands and then I'll move to you in turn. But we've already got a question ready and waiting for you. So I will.
There are probably lots of things I haven't explained fully, so please ask. Lots of things you might disagree with too, so please tell.
Well, Rob asks, on the quantitative analysis, were you able to analyse the dynamics of insecurities, i.e. the extent to which they were temporary or prolonged experience for individuals, as with longitudinal dynamics of poverty research?
Brilliant question, Rob. Thank you very much. The answer is sadly no, but the reason we chose Understanding Society was because it offers that potential. So we'd like to go back and do that again, and we will be able to track how long people experience these things for, and also how one insecurity might lead to another over time. Unfortunately, we were only given 10 months and we just couldn't pack it all in.
Thank you. Does anybody else have a question? If you like to raise your hand, I'll. Lovely. Ed's put his hand up twice because I've been ignoring him accidentally. You're just on mute, Ed, but there you go.
Thanks. Thank you. Hi, Becky. Thanks very much for really excellent presentation. Really interesting. I was just feverishly typing away my question, but I may as well just ask it verbally. Just thinking about the different geographic contexts for your qualitative work. Was there anything sort of coming out of your participants or from the kind of analysis that you did, bearing in mind, you know, the nature of the qualitative interviews, that sort of spoke to the different broader housing and labour market characteristics, you know, or were those kind of less important? Were these kind of multiple insecurities happening everywhere and anywhere, and the kind of conditioning role of those wider markets less important?
Well, thanks a lot, Ed. That's a really good question. We wanted to have these diverse deprived areas in different parts of the country with very different housing and labour markets to explore that issue. But I don't want to say too much on the basis of 36 people. Nonetheless, it was clear that there are different populations, different housing situations in those areas. So, for example, Mablethorpe in East Lindsey, there is a very weak labour market. And there are also a lot of people who've gone there to retire. And these are people who retiring from the inner cities of the Midlands. So then they don't have a lot of money to start with. They tend to bring a lot of health problems and not much money with them. So and there's also almost no social housing in that area. So you've got a nest of problems there of people who might have an outright owned home, but not much income or equity, and there also aren't many services. So it's quite a distinctive pattern of insecurity and issues for dealing with them as well. Whereas in you have a contrast between the Sheffield and Milton Keynes groups. Again, I can't say too much because it's on the basis of a small number of people, but the Sheffield respondents talked a lot about housing problems, whereas that wasn't such an issue in Milton Keynes, which has a younger housing stock in all tenures. I think that the Sheffield population was more perhaps linked to industrial history of the region, whereas the Milton Keynes respondents, many had a story of moving to the new town in their youth to work. So they were skilled working class in background and slightly different stories going on there. For example, some of the older people had reasonable work pensions, which most people in Sheffield who were older didn't have. But this really to be explored more. I think maybe there is something you can get from looking at these sort of measures that you can't get from thinking about deprivation in different areas.
Thanks. That's great.
Thank you. I've got a question from Ian and then some more questions in the chat. So Ian, I've unmuted you.
Okay, can you hear me?
Yeah.
Hi, Becky.
Hi.
I'm just pondering the relative merits of having a fairly broad definition of insecurity as opposed to a narrower one. It seems to me yours was the one you've been using is a broad one. And whether that's possibly then dilutes some of the issues about what you need to do to contend with it. I'm thinking of the information you had about being a poor landlord, not offering a good repair service, having overcrowding. I mean, those are issues. They make people unhappy, things that need to be dealt with. Are they per se linked to insecurity in the same way that the more obvious things around your tenancy, the security of your tenancy is? And if it's not, does the menu then just become, well, you know, landlords need to be better at everything, rather than something more specifically? And the reason I think that's important, and then I'll shut up, is obviously historically one of the great things about council housing was that it offered security of tenure. It would take a lot of variation from that, but it in a way that other landlords, including housing associations, didn't. And I just wonder if that might all get lost in the mix on people being unhappy about repairs, etc.
Yeah, thanks again. It's a really good question. So I've got to say I was equivocal at the start of this project about whether we needed another ism or another, term or concept or measure. But I think it's all down to what you're doing. So it's the concepts you need for the purposes. It's the measures you need for the particular purposes. And I think you're right. This does have a blurring effect to some extent. But on the other hand, I think trying to quantify insecurity has a value when you think about how it's affecting such large chunks of the population. So the fact that 47% of people in 22-23 were financially insecure according to these simple measures was quite a shock to me, and I think does explain some of what's going on in public opinion, for example. So for some things you need simpler measures. For others, you need very targeted measures. So if we want to know what's going on in social housing, you'll need some quite different measure. Yeah, so I think there is a value in trying to think about insecurity as a subjective as well as objective measure, and as about worry, and as something that affects people's health, mental health. And you can't just look at one aspect of security for that, although there's been really fantastic work done on the mental effects of housing insecurity recently and the health effects. I think making an effort to try and look at all of the things that people are worrying about is useful. But I totally agree that we haven't really cracked it, because both on the quantitative and qualitative side, we've moved away from the pure concept of insecurity.
Yeah.
Quantitatively, we weren't able to get all the measures you would want, and qualitatively, we don't know exactly what people were thinking about when they selected a card and said, I'm financially insecure. And they were thinking about, each of them was thinking about something different. And some of them were just thinking about problems, whereas some of them were thinking about insecurity, meaning worry, meaning change, meaning worry about the future. Yeah.
Thank you. And we've got multiple questions in the chat. So Jamie says, thanks, Becky. Really enjoyed your presentation. You spoke quite a lot about structural disadvantage and the sense of powerlessness people experience. I was wondering if you got a sense whether any choices people could make compounded the insecurities they were enduring, or was it more that they felt they had no real agency at all to influence their lives?
Oh, thank you for that question as well. We were keen to give people in the qualitative part plenty of chances to talk about things that helped, things that they did that helped, and how they reacted to the situation, how they planned in the face of these insecurities and uncertainties. And I don't think we came across many examples of people making choices that made things worse that were real choices. So there were people who'd given up, for example, on their plans for training, which might have led them into jobs or better jobs. But that, in their circumstances, they didn't have a real choice to do that training because it wasn't available. They didn't have the childcare, or it was too costly. So there are lots of people who had aspirations that had gone by the wayside, but I don't think you can say there was any other way they could have addressed those. We were, because we started off thinking about levelling up and how this could contribute in some way, we were thinking about whether people were making choices not to work or not to train or not to move or do all these sorts of things. But when we talked to people about what they'd done in their lives, there'd been quite dramatic plans that people had made that hadn't always come off. So a couple of people planned to emigrate because the cost of living would be lower somewhere else, and it might be better for their health. Some people had already moved to Mablethorpe to get cheaper housing because they'd be able to move from private renting to buying. And people had done all kinds of quite dramatic things to manage on low incomes and to support their children in particular. So there's plenty of sign of ingenuity and agency, but highly constrained.
Thank you. Jamie, do you have anything to add? No? Okay, Richard's. Oh, and also just a message really, but Catherine just wanted from Joseph Rowntree Housing Trust, just says that she particularly appreciated your insights on insecurity among socially renting people, and she'll be sharing her thoughts and those thoughts with her colleagues. Richard says, great presentation. Given the significance of financial insecurity in the data, what would you say your work adds to existing understandings of the multidimensional nature of poverty, and what would your key messages be for policymakers?
Okay, that's a really good question. Yeah, we already know a lot about financial insecurity and how difficult it is and what it does to people's lives. I think it is useful to link it with some other major insecurities, particularly housing insecurity and employment insecurity. And there's been, as I mentioned, a study that's looked at that particular issue. So why is it that people who are in the least secure jobs are also in the least secure housing? Well, it's not a surprise because of financial insecurity as well, but it does mean that their lives are more difficult in a way that you can't fully understand if you're just thinking about managing budgets, the consumption of food, and the consumption of housing. So it's not just the ability to pay for housing, it's about the ability to stay in the housing as well, and the extra costs that come from forced moves and the extra mental impact of worrying not just about paying the rent, but being evicted too. So I think it just gives, I think going beyond financial insecurity just gives you a richer picture. And that's all I'd say. I mean, sometimes you won't need a richer picture. It depends on what you're focusing on.
Brilliant, thank you. And Rob says, fantastic presentation and project, thank you. I wonder if there could be any wider political resonance for a narrative of security and insecurity. Occasionally, Starmer and Reeves use the language of security, as you noted, and it could bring together themes you've been describing, as well as things like global instability. Could it become a unifying theme for this government, which is often criticised for lacking vision?
Thank you. Well, yeah, you spotted that I've been trying to link the current government member statements in with this. The team as a whole think it could be a way to broaden out concern about the difficulties that people are having across the population. So this isn't just a low-income person's thing. It's not just a deprived areas thing. It's a problem that people in middle incomes and upper incomes are facing to some extent, although they have more resources to deal with it. And might be possibly a source of the general national malaise that everybody in the population is experiencing, and might be a part of the source of populism and the rise of reform. People who, this is just a hypothesis, but if we find out how long people have been experiencing these insecurities for, it's not just your material resources and your social network resources that will be used up over time as you contend with these things over an extended period. It's also your mental resources. And so the sense of national frustration, perhaps desperation, mental health problems, which are on such a large scale, could possibly be to do with this long period of multiple stresses on the whole population, or large chunks of it. So I think this could be a potential area for discovering the cause of national malaise, or one of them, and it could be a potential area for proposing solutions that will affect everybody. This isn't just about poverty; it's about the large chunks of the population, and really everybody wants to feel secure. Or looking at all the individual indicators that we use in the quantitative work. All of them were correlated with neighbourhood deprivation, whether in England, Wales, or Scotland or Northern Ireland, except for one. And there was one that was more prevalent in areas that were less deprived rather than more deprived. And that was worry that your financial situation would get worse. So even the people who've not been affected by so much by all of the other indicators of insecurity are affected by pessimism and fear about the future, that things may get worse for them. So sorry, that don't want to finish on pessimism and fear, but I think there might be an empirical basis here for understanding what's going on and proposing solutions, and there certainly is a rhetorical basis, I think, in it.
Brilliant, thank you. And Ed says, thinking about Mablethorpe, at CRESR's PPP conference earlier this month, there was a really interesting presentation by Edward Hart from the University of Hull, who says capital and illness within a small declining resort town, an ethnographic exploration of struggle and restitution, which had some really interesting ethnographic insights to multiple insecurities and connecting these to some of the life histories of participants. One finding that really stayed with me was about the reasons for some younger, i.e. not retired people, moving to the coast, the insecurities they were facing, but also dynamics, a contrast with existing populations and their securities.
Oh, thank you very much, Ed. I didn't know about that piece of research. I know that there's been quite a few pieces of research done in Mablethorpe. It's one of the successful industries there, is people being hassled by researchers. I think that is a problem in its own right. Yeah, that sounds very, very interesting about youth and possibly illness as well. And one thing we came across in the people we talked to in Mablethorpe was quite a few younger people who had disabilities, or who older people who've been recently diagnosed as autistic, and both the difficulty and then the diagnosis were creating lots of change in their lives. And that added a whole nother dimension that we didn't pick up properly with the quantitative data, of course.
Yeah, so it was a presentation at the conference.
Oh,
I don't know if there's a paper attached to it, but we could try and dig out the reference to it at least, or some contact details in case you wanted to pick.
That'd be great if you could. Yes. Yeah.
Try and do that.
Thanks, Ed.
Well, thank you so much. That was really fascinating, and I'm sure that we'll all be keenly watching to see where it goes next. So thank you so much for your time today. And if anybody has any other questions or anything they'd like to ask, please just get in touch with me, and I'll forward them on to Becky.
Thank you. Yeah, thank you. Well, I'd like to say thank you to you, Becky, and thank you to everybody else for coming along and for your questions. It's been really, really great, and I really appreciate your interest. And please do get in touch with anything at any time.
Thank you, Becky, for an amazing presentation, and thank you everybody for fantastic questions. Goodbye.
Bye bye.